Welcome back. You're watching SABC News Prime Time. Now, today is World Cancer Day. According to stats, cancer kills more people worldwide than AIDS, malaria and TB combined. Although the incidence of cancer is highest in developed countries, the impact of the disease in the developing world is growing at an alarming rate. In studio now is Noelene Kotschan. She's the CEO and founder of the Pink Drive. A very good evening to you. Thank you for coming through. Tell us about the Pink Drive. What do you do?
Well, we've built the first mobile mammography units in sub-Saharan Africa. We've been running since 2009, and basically what we're doing is government's work, because currently with one such mobile unit we are working at 20 public sector hospitals, all with no government funding. So what we do is we work in conjunction with the breast units at those hospitals, and in many instances we either work at the secondary hospitals or the clinics that feed into a tertiary hospital. But before we start on the outreach, we've worked at the hospitals to clear their backlogs, because that's actually the biggest problem in the mammography space in South Africa. So we clear the backlogs and then we start the outreaches.
So no government funding would mean you rely on donations?
Absolutely.
And how is it raising funds in this difficult economic climate?
It's obviously not easy, but I think that, since we started out, the brands got bigger and bigger. And tragically, so is the disease. So I won't say it makes it easier, but South Africans are actually the most giving nation. But you've just got to make it simple and easy and let them have fun. And they will come and they will donate. Because I don't believe that there's anyone in South Africa that has not been touched directly or indirectly by the disease.
So today, World Cancer Day, you were at the taxi rank in Barra, where you were screening people. Why were you there particularly?
Well, I think that after having met, the powers that be at Santaco, their whole thing is about keeping their taxi drivers healthy. And obviously, if you can keep the taxi drivers healthy, ideally you want to keep the commuters healthy as well. And, I think everyone's got this whole thing about taxis, they're either going to wipe you off the road or something like that. But when one starts looking at the long hours that they work, they're also under rather stressful conditions. And all of those are catalysts for triggering cancer. And when I met with them late last year and I explained what we would like to do in conjunction with them, they said it fitted perfectly in what their vision is in rolling out health clinics at taxi ranks, and they will be 24-hour clinics.
How was today's response in terms of people coming to get screened?
Well, it was absolutely amazing. I mean, I had enlisted the assistance of the doctors at Chris Hani Barra, because obviously we were right opposite, the hospital. So the breast unit came out, Dr. Kotschan, all the breast clinicians from the urology department, because we don't just do breast cancer, we do cervical cancer, and we've also got a male campaign which is growing, I suppose, in leaps and bounds as well, and that's called More Balls Than Most, and that focuses on prostate and testicular cancer.
What are the biggest cancer threats in South Africa? Is it breast cancer?
Well, most definitely in women, and breast cancer has surpassed cervical cancer now. That's a known fact. Mm-hmm. And in men, it's prostate cancer and colorectal cancer. So, and they are growing, and as you said earlier, cancer worldwide, the stats that are available, and that's from the World Health Organization, kills more people than the sum total of HIV, AIDS, TB and malaria. And tragically in this country, we don't have a cancer registry, we don't have cancer guidelines for breast cancer, we don't have it for cervical cancer, neither do we have it for prostate cancer.
Why don't we have a registry?
I don't know. I think you must ask the Minister of Health that. And it's not from lack of lobbying by, cancer NGOs. I don't personally, my involvement in the cancer space is, I don't think, and tragically, that our National Health Department sees that cancer as a disease is a priority as they treat HIV/AIDS.
Do you think possibly if we did have more stats and a registry that cancer wouldn't be sidelined to other diseases like HIV and TB?
Absolutely. I mean, if you don't have the ammunition, how do you fight a war? The ammunition is the data. And I mean, since inception, we've been collecting data. So we actually have the first true data in the breast cancer space, even if it is only out of one community or, one province. And I mean, our data, I couldn't even get analyzed here in South Africa. It is now being analyzed by the World Health Organization internationally, So all of these things, it's actually very tragic.
What are the other challenges you face in terms of rolling out advice and treatment? Do you find that you have to deal with lots of misconceptions around cancer?
Well, absolutely, and our whole focus is communities. We are community driven and based. And so there's so many myths and stigmas still attached to the disease. HIV has been extremely lucky from their educational process, but then they had billions pumped into them to roll out educational programs. Cancer doesn't have that. Well, definitely not in South Africa. So, that's our biggest hurdle. But what we do know is that the communities trust us, they welcome us, and we have never, since inception, ever let a community down. So when they know that we are coming, they come out in force, and it's really, that bush telegraph just gets going. We don't have to advertise it really anymore. We let them know at the clinic sends out the word, and the people are there.
Well, I'm going to let you advertise a little bit now. If people do want to get involved and help, how can they do that?
Well, twofold right now. We've got the pink cricket coming up next week. Very easy. SMS 40158, donate 20 Rand. And I mean, you stand a chance of winning some amazing prizes, from Rovos Rail to air tickets to you name it. And the other thing is, go onto our website, www.pinkdrive.co.za, and it will take you to where you can either make donations. We've got an international donation line now via PayPal or Give and Gain, and naturally there's the South African banking accounts. So it's simple, it's easy. We need corporate South Africa, and we need the individuals to assist us. One truck costs 10 million Rand to build, and the project currently costs 650,000 Rand a month to run. But when you break that down to that it can do 20 hospitals work with 2 drivers, 2 mammographers, 2 nurses, you can't, and per hospital it costs you about 32,000 Rand a month. You can't employ a mammographer for 32,000 Rand, especially when there's such a skill shortage.
And I suppose your underlying message to South Africans would be to get screened.
Absolutely, because early detection, I think like in any disease, will save your life.
Thank you very much. That was Noelene Kotschan. She's the CEO and founder of the Pink Drive, talking to us about their initiative. Stay with us on SABC News Prime.